Good afternoon, and thank you all for joining us today in our 19th Annual Summit on Health Disparities. I'm so pleased to be serving as the MC for the Congressional Awards and Fireside Chat. My name is Nicole Varner. I currently serve as the Chief of Staff to Congressman Marc Veasey and the former Executive Director of the CBCF Health Braintrust. As you all probably know, the CBC Health Braintrust serves as the advisory body for members of Congress and the CBC and guide health policy decisions and directives of the Caucus. We are fortunate to have had the support of the NMQF in years past and this year, and are happy that we're able to work with them to help us advance policy directives for minority individuals. I'll begin by introducing Dr. Gary Puckrin, CEO and President of the NMQF, who will recognize Chairman Richard Neal with the Outstanding Congressional Leader Award. Dr. Puckrin. Dr. Puckrin, I'm so sorry, you're muted.
I'm always doing that, sorry. I live in Zoom land and I still don't get it. Congressman Richard Neal of Massachusetts chairs the oldest and arguably the most powerful committee of the United States House of Representatives, the Ways and Means Committee. As a person that controls the revenue for the nation, his priorities become the priorities for the country. Earlier this year, Chairman Neal announced the Racial Equity Initiative to guide the work of the Ways and Means Committee. This initiative represents the next phase of the committee's work to address the role of racism and other forms of discrimination in perpetuating health and economic inequalities in the United States. The creation of this initiative follows the report, Something Must Change, Inequities in the U.S. Policy and Society, and the framework, A Bold Vision for a Legislative Pathway Towards Health and Economic Equity. I invite you, our audience, to read both of these reports to understand the work and thoughtfulness that Chairman Neal and his committee put into this effort to address inequities and to build sustainable, healthy communities. Regarding this work, the chairman states, the REI working group amplifies opportunity and makes recommendations to ensure the committee is leading with justice, forward legislation. I am thrilled they have stepped up to the chair to chair this momentous work and look forward to joining them in advancing meaningful, transformative policies that make the American dream more achievable to all. It is for this work, that we are pleased to present this award to Congressman Richard Neal.
Good afternoon. Welcome to the National Minority Quality Forum's 2021 Leadership Summit on Health Disparities and Health Braintrust. Amazon is proud to be the sponsor of this year's 40 Under 40 Leaders in Health Gala. It's actually a gala that, and a distinction that I was honored to receive in 2017. And so both this event and what the forum has been doing to address health disparities writ large, both before the pandemic and now, I've been very close to, and it remains vitally important. Amazon proudly supports the National Minority Quality Forum in their efforts to use data and research to deliver quality healthcare.
It seems we're having some technical difficulties given our new virtual environment. Please bear with us, folks. while we're waiting for the right video to come up, I just want to give Brandon Garrett, the COO of the NMQF, the opportunity to introduce Orriel Richardson and present her.
All right. Well, thanks so much. Really appreciate that, Nicole, and thanks for just being clutch right there. Really appreciate it. But behind every great member, like our honoree Chairman Richard Neal, there are great staffers that make things happen. Orriel Richardson is that great staffer. Originally from the great state of Louisiana, Orriel is an attorney and health policy expert who serves as health counsel for the Committee on Ways and Means. She works on establishing the committee's racial equity initiative and proceeding report and framework. She has also led work involving cross-cutting legal and program integrity issues for models being tested at CMS. Previously, as an attorney with the District of Columbia's Medicaid agency, she advised the rates and reimbursement team that oversees $3 billion in annual provider payments. She's really into health. She's a professional lecturer in health policy and management at George Washington University's Milken School of Public Health, vice chair of the Membership and Delivery Payment Reform Affinity Group for the American Health Lawyers Association Regulation Board, and finally, she's very DC, she's vice president of her condo association.
It's a pleasure to be with you.
She's a proud alumna of Howard University. She received her MPH from Tulane University and her JD from George Washington University, and holds a graduate certificate in international human rights law from New College and University of Oxford. Finally, I got to really know Orriel last year when she was a 2020 NMQF 40 under 40 awardee, and we had the great opportunity to work with her throughout the year on a lot of these initiatives. So without further ado, I present to you our outstanding congressional staffer, Orriel Richardson.
Thank you. I must begin by thanking Dr. Puckrin, Mr. Garrett, and the entire NMQF team for this recognition and for being supporters of the Ways and Means Committee's work on racial health and economic equity. My journey began in Bastrop, Louisiana, as Brandon mentioned, as a bright girl who aspired to be a physician. It seemed the most appropriate of what I understood to be the three most acceptable options for people who considered themselves young, gifted, and Black, with the other two being lawyer or engineer. I had an older brother who had scaled Southern University in Tuskegee to become a successful engineer, and an older sister who excelled at Grambling and the University of Florida to become a brilliant attorney. So I just knew my path to doctor was solidified. Then my father allowed me to accept the offer to attend Howard University instead of staying closer to home. There I enrolled, and I did graduate with a degree in biology pre-medicine, but I also minored in chemistry and Spanish and classics. The latter part, peering through antiquity to understand how we even came to organize civilization itself, really planted the seed that led me to understand that I would probably not end up being a physician, and I needed to look a little bit higher. My struggle was with wanting to help as many people as possible, recognizing that a single clinician could only touch so many patient lives over a career. And I looked for options to do more, especially following the death of Prince Carmen Jones, my freshman year, where I found myself marching alongside fellow students of the U.S. Department of Justice, demanding just that, some form of justice. Fast forward, I enrolled at Tulane, focusing on health policy and management, because that is the line that so few students of color were in at orientation, and because it's never a bad idea to follow the money side of the thing. So after seeing wholesale systemic failures during the response to Hurricane Katrina, I understood clearly that my future was to be in figuring out the policy and the very laws that govern the system itself. So I worked hard, I sacrificed things, but upon graduating from law school and the evening program at that, I started a career in Medicaid policy. I shifted into the federal government, and then I found myself at the throes of defeat sometimes, but also at the threshold of opportunity, where I was able to come and join the legislative branch. Along the way, using lessons from my parents, especially my father, that continue to ring true. To honor God, for only what we do for Christ will last. To have integrity, and to always let service be the paradigm for your life. Since arriving on the Hill in January 2019, The support of this committee through Chairman Neal's leadership and the unparalleled staff leadership of Brandon Casey and Amy Hall, it's helped me to put those lessons to use and do the exact type of work that I'd only dreamed about. So thank you to the team I've dubbed as the Health Equity Avengers, Melanie Gordon, Sarah Levin, and Fabian Lucero. And a special thanks to Rachel Dolan for being my co-pilot on this journey. And again, thank you to NMQF for allowing me to receive and accept this honor in memory of my father, the late Reverend Henry Ford Richardson. Thank you.
All right. Thanks so much, Orriel. You've done an amazing, by all the awards and accolades and the work you've done, you can see that you've done amazing work. And want to mention this again, there are some great
pleasure.
Anna, and we also have some great people from Massachusetts, and I'm gonna go ahead and let the chairman from Massachusetts remarks be played.
It's a pleasure to be with you today. I'm immensely humbled to be accepting one of the National Minority Quality Forum's highest honors, the Congressional Leadership Award. First, I want to take a moment to personally thank you for the critical work that you do to address the ways in which health disparities negatively impact our communities. Your research and advocacy are vital to closing the health gaps that exist for too many in America. While the pandemic has no doubt been a public health emergency, its stark and disproportionate impact on communities of color has also shown how deeply ingrained patterns of inequity are in our society. From my position as chairman of the Committee on Ways and Means, I see clearly that we must address the interconnected issues of health, economic, and racial inequities. And I'm proud to say that our committee has been a leader in calling attention to understanding and addressing these structurally ingrained issues. When passing the American Rescue Plan, our committee made sure our provisions were prepared to support the most vulnerable members of our society. We included key tax credits aimed at helping workers and working families to lower healthcare costs and extend federal unemployment benefits, to name but a few. We know that low and middle income Americans and communities of color are bearing the brunt of this crisis. That's why we have made sure that your voices are being heard in Congress. Another recent example, and one of my proudest achievements, is the Ways and Means Committee Racial Equity Initiative, a working group I launched early in March of last year, which focuses and enhances the committee's equity work. Looking forward, as we tackle many of these issues, like infrastructure, paid family and medical leave, and affordable childcare, we consistently look at the ways in which these issues intersect with factors of race, socioeconomics, and gender. Working together, I know that we can and will secure a healthier, more just future for all members of our families. Thank you.
Those are great words from the chairman. Now I want to turn to actually Mr. Jerry Steffel, who we will be presenting with the Outstanding Healthcare Policy Leader Award. Jerry Steffel is the principal liaison between the Blue Cross and Blue Shield plans in Illinois, Montana, New Mexico, Oklahoma, and Texas. Can't get away from him. Former boss, current boss, and policymakers on Capitol Hill. Jerry has over 20 years of experience representing healthcare organizations at the state and federal level, including providers, pharmacy benefit managers, and health plans. He previously represented the Pharmaceutical Care Management Association, Prime Therapeutics, Anthem, American Psychological Association, and the American Medical Association. Jerry, thank you so much for being here with us today, and I'll turn it over to you for a few words.
Well, thank you, Nicole, and thank you to Congresswoman Kelly and the National Minority Quality Forum for this honor. I admire the work that you all do to ensure everybody has the possibility of good health, and I especially want to congratulate Congresswoman Kelly on the Mamas Act. I certainly wasn't expecting an award, but I have enjoyed working with the Quality Forum over the years, and I'm excited about the policy that has been enacted in just the past few months. For example, making it easier for states like Illinois to extend Medicaid postpartum coverage to a full year. This will help ensure that new mothers and newborns have better health outcomes, expanding the reach of the Affordable Care Act subsidies, and expanding the reach of Medicaid. These are important policies that will impact access to care, even though there is more to be done to ensure that they are made permanent. I'm fortunate to work for a company like HCSC and its 5 Blue Cross Blue Shield plans that is committed to finding focused and durable solutions to health disparities and social determinants of health, such as a commitment to ensuring our members have access to providers who reflect the patients that they serve and are trained in cultural differences. There are many more policies to pursue to expand access to care and to address social determinants of health. And I look forward to continuing to work with the National Minority Quality Forum on these important jobs. So thank you very much for this award. Nicole?
Thank you so much. Now we'll transition into the fireside chat portion of our afternoon with Anya Malkov. Apologies if I don't say your name properly. But we are going to discuss briefly the role of employers in vaccinating vulnerable populations. Anya, would you like to say a few words before I start?
You can kick us off. Thanks so much for the introduction, Nicole. It's I guess I'll just say, it's a real pleasure to be here. Thank you for having me. Thanks to you, to Dr. Puckrin. It's also wonderful to be sharing this virtual stage with today's award recipients. So congratulations to Congressman Neal, to Orriel, and to Jerry. And on behalf of Amazon, I'll just say we've truly enjoyed working with the National Minority Quality Forum, and we commend your innovative, data-driven approach to helping close health disparity gaps that exist in America.
Fantastic. So as we are working our way out of this COVID-19 pandemic, we are trying to, vaccinate as many individuals as possible. We started off with more vulnerable populations, which were the older individuals. And now we've opened up vaccination to just about everybody, with the exception of children across the country. But it was reported recently that Black and Hispanic people are still receiving smaller shares of vaccinations compared to their share of the total population and the number of COVID cases and deaths that we find in these communities. Despite federal and state efforts to improve vaccine equity, we are going to have to think outside the box to reach these vulnerable populations. And workplace vaccination is one promising approach that we have found, or that we are considering, to reduce vaccine access barriers. And we worry that it hasn't received enough attention. In fact, Dr. Nunes-Smith earlier this week mentioned employers working with employees to get vaccinated. And so I'm so pleased to have Anya with us here today, as she's the head of US vaccine policy at Amazon and is here to share some insights with us on this subject. So turning to Amazon, Anya, what has Amazon done to advocate for its employees to get access to vaccines?
Thanks, Nicole. First of all, I couldn't agree with you more. Employers have a very important role to play in the vaccination effort. This pandemic from the start required an all of society response, and vaccinations are no different. At Amazon, our goal is to provide all of our employees with the ability to receive a COVID-19 vaccination if they choose to do so. We have more than 1 million employees in the United States. Most of them have been classified as essential during the pandemic, and we're very proud of the role that our essential employees have played. They've helped customers stay safe, to receive important products at home, to get their groceries at home. And we have been advocating since last year for them to be vaccinated at the earliest appropriate time. Our CEO of Worldwide Consumer, Dave Clark, actually wrote a letter to the CDC back in December, where he urged for prioritization of essential workers, including Amazon employees, for vaccination. And we then shared that same message with governors in almost every state. everywhere we have employees, which is almost every state. And then, not sort of satisfied, Dave also wrote to President Biden moments after inauguration, letting him know that Amazon was prepared to help vaccinate our workforce. And we then met with the White House COVID-19 task force to reiterate that message and to really highlight the unique role that large employers like Amazon can play in vaccination.
Thank you for that. So you guys have definitely been advocating, it seems, for vaccine-free employees to be prioritized. What exactly have you done to help these employees get vaccinated?
Of course, so our goal from the start was to make vaccination easy and convenient. Convenience for our customers, right? That's what Amazon does best. And what can be more convenient than getting vaccinated at work during your shift? So we actually partnered with multiple healthcare providers to create on-site vaccination efforts for our employees, and we worked to build that out at hundreds of our operation sites across the United States. And we knew that would take time; it wouldn't be available right away. So back in February, we introduced our vaccination benefit, offering up to $80 to Amazon Essential employees who became eligible and got vaccinated in the community. Now, as many of you know, different states did prioritization very differently. They moved at different rates. We also have employees that are in different priority groups, whether they're grocery or not grocery, that matters in some states. So what we did, we had a team tracking and sharing eligibility information with our employees. We actually created a website where, anybody internally can go and see, am I eligible? And that had links to state or local registration options. So that service was another way for us to help employees and to encourage them to be vaccinated as soon as possible. But in the meantime, behind the scenes, we were working very hard on that workplace vaccination solution. So March 25th was a very exciting day. We launched our first on-site vaccination event in St. Louis, Missouri. And in the following few weeks, we expanded to several other states. And now, this week, in partnership with local and state health departments, we're actually expanding across many states and multiple facilities. We're in Las Vegas, we're in Austin, we're in Oklahoma City. Shout out to Congresswoman Kelly, we're in Will County, Illinois. Nicole, in your home state of Alabama, we're expanding in the Birmingham area this week. So, stay tuned sort of for more news here, but we're definitely expanding. And already in just the first, several weeks, thousands of our frontline employees have taken advantage of the program. And of course, we're going to continue to expand as vaccines become available. And rather than just talking about the program, I'd actually love to show you all what it's like for our employees to be vaccinated at Amazon. And I've got a video, so I think it's going to play.
If I can get my shot today and reduce the spread of COVID, maybe I'm saving a life tomorrow.
It was a lot easier than I thought it was going to be. We've been through the pandemic for like pretty much a year now, and to be able to help that is just like a big privilege to me.
The experience with getting the vaccine was very easy, very simple. It's very big that Amazon is providing this service for associates.
Eager for the next dose, that's for sure.
Awesome. Thank you. So I actually got to visit one of our sites in Virginia yesterday that was setting up for an event today, and they were making the space look like what you just saw. I got this official t-shirt. And something I want to highlight from that video is that the vaccines are being administered and handled by our healthcare partners and their licensed clinicians. Our partners also handle all of the appropriate state, federal reporting. And this, on-site vaccination program is something we're very proud of. It is unique. Certainly other employers are providing vaccinations, but we have not seen anyone attempt it on the same sort of national and international scale.
That's fantastic. And thank you so much for your video and the information that you provided. I guess, as we are going through this vaccination effort, is there any particular efforts that you all are taking to do outreach to and increase vaccine uptake among your employees of colors, specifically, I suppose, the Latino and African American employees?
Yes, Nicole, of course, as we know, far too often the zip code in America determines your likely health outcomes. And so many panelists today have spoken to that. And we also know that communities of color have been disproportionately affected by the COVID-19 pandemic. And these communities are still facing challenges in terms of access. The vaccine distribution panel just before lunch, I think everybody on that panel said something about access. And at Amazon, we have been systematically removing barriers to vaccine access. We're making vaccination easy. So first we had the vaccination benefit, time off option for offsite vaccinations, a policy of excusing absences if a vaccine appointment was during a scheduled shift. Those measures were designed to help our employees get extra flexibility to be vaccinated. And that's something that many other hourly employees do not have. Our employees also have access to paid leave that they can use to recover from any side effects. Now, today, with the launch of the on-site vaccination program, we're creating a path for all employees, especially those who face challenges navigating the traditional healthcare channels. We're helping them to access the vaccine easily, conveniently, and with minimal interruption to their daily lives. And we actually ask our participants to fill out a voluntary survey about their experience. And we've had a significant number of folks say, if it wasn't for this opportunity, I wouldn't have gotten vaccinated, or maybe I would have gotten vaccinated, but I don't know when. So those are some early indicators that easing access is actually improving adoption. And so, for communities of color, if access is an issue, we're helping remove that barrier. Also, wherever possible, we are inviting employees to bring members of their households to be vaccinated. We want our employees to be safe both at work and at home. And we know that for those whose family members have been unable to find appointments in the community, this is a big deal. They've been very, very appreciative. And we're not able to do this everywhere. There's regulations, there's site capacity limits, but we really do try to make that vaccinations available to households wherever we can.
And you mentioned that you all work with your community partners in order to make this more possible or make it better accessible for your workforce. But how can you address some of the hesitancy that you see among the workforce when you are offering these vaccination opportunities?
Absolutely, Nicole. Access to vaccines is one issue, and hesitancy is sort of the second piece of the puzzle. And multiple speakers today talked about the trust in vaccines being low in communities of color. Of course, this is a direct result of a long and painful history with government, with healthcare systems, and this problem is not unique to Amazon, but of course we are also contending with it. I tuned in this morning to the great panel that Dr. Latasha Lee led on African American education and outreach. Took lots of notes. And one of the things that stuck with me is what Dr. Brooks said about addressing vaccine hesitancy. And I'm paraphrasing, but he said, you have to look the person in the eye and accept that where they're coming from is real. And then you build a conversation from there. And Dr. Brooks, Dr. Puckrin, other panelists, all spoke about the importance of trusted messengers. So what we're doing in the context of our sites is engaging trusted messengers, right? So through peer-to-peer and through site leader engagement. We have been finding messengers who can speak to the unique experiences of our employees and to meet them where they are. We have videos of associate testimonials. We make sure that the site leaders set the tone for their buildings by getting vaccinated, by wearing the t-shirts. You saw some of that in the video earlier. And we also encourage employees to submit their testimonials, which can get featured on Amazon's Instagram account and other channels. It's at Amazon Vest Life, by the way, if anybody's interested. There's also a lot of peer-to-peer engagement that happens. That's hard to quantify, but you'll hear in the break room and on the floor, people just sharing with their coworkers, oh, I got vaccinated, it was easy, this is why I did it, this is for my family. And then something else we've tried too is some fun things with celebrity messages. We had Cedric the Entertainer do a message for our Missouri folks, he's from the area, and Anthony Anderson of Blackish record videos. We're really trying all the different angles to encourage our employees of color to be vaccinated. And just a last thing on messaging, I want to mention the Ad Council for any other sort of employers who are watching. Ad Council has a fantastic suite of research-based education materials specifically for employers. We've been utilizing those. Amazon's actually a founding funder of the Council's COVID-19 Vaccine Education Initiative, which is one of the largest public education campaigns in history. So, I hope that this all society approach that faith leaders are doing things and community leaders are doing things, and that employers are also really working to build that vaccine confidence.
And that's a really good point that you just made, employers working to build vaccine confidence. This leads into my next question, actually. Why do you think that workplace vaccination can help better reach minority communities?
Yeah, so first, getting vaccinated in the workplace is convenient, right? You don't have to search for an appointment. You don't have to be up in the middle of the night refreshing a website. If you're somebody, if you're an hourly employee or you're working multiple jobs, you don't have to take time out of your day to go sit in line at a mass vaccination site for an hour. So that can help, anybody. But also workplace vaccination events, they take the burden off of community vaccination sites. They allow the community sites or local providers, that federally qualified health center, that mobile outreach clinic, who are really plugged into the community, that allows them to really focus on targeting the hardest to reach individuals. And the example here is COVID-19 testing. So today it's a lot easier to find, but through most of 2020, it was hard to find in many communities. And so Amazon actually built a COVID-19 testing program from scratch to ensure that our frontline employees had access to free and regular testing, and then they didn't have to rely on the community testing sites. And our approach to vaccinating our workers is really informed by that experience of building and scaling the on-site testing program. And I want to also share a Texas story here. I know, Nicole, you're Chief of Staff to Congressman Marc Veasey. I worked for Congressman Doggett a while back. So Texas example, in March, Texas was rightly criticized for inequitable vaccine distribution. At that point, Black Texans, who are about 13% of the population, had gotten only 6% of doses. Latinx individuals at 40% of the population had received less than 20% of doses. Now today, the latest data from Kaiser Family Foundation shows those gaps narrowing, especially among the Latinx population. They're now at 30% of doses. So what has Texas done differently in the intervening weeks? Multiple things, but one of the strategies was partnering with and directing vaccines to essential employers. The health department actually called us, and we were able to launch our first Texas on-site event about 2 weeks ago in San Marcos. At that event, more than 1,000 people and their family members got vaccinated in just a few days. Now, it's too early to say quantify the effects of workplace vaccinations here versus broader availability. I'm the first to say correlation is not causation. But what the Texas example demonstrates is that governments can change course. If one strategy is not working to reach minority communities, you try another one.
Exactly. And a few moments ago, while you were speaking, you mentioned that workplace vaccinations help to take the burden off of community vaccination centers or community vaccination efforts. But is there anything other than providing workplace vaccinations that you guys are doing to help the community vaccination efforts?
Yes, we are actually. There's a number of things. I think the most visible examples have been our community vaccination clinics in Seattle, Washington, and Arlington, Virginia, our two headquarters locations. Between the two of them, we've helped administer more than 60,000 vaccine doses to community members. The Seattle clinic launched back in January in partnership with Virginia Mason Hospital System. And Amazon provided space, non-medical supplies, logistics support, and volunteers. And then the Arlington clinic launched in March in partnership with Arlington County, had a very similar setup. And back in January, there were no manuals available for how to run something like this. FEMA hadn't even put out their playbook yet. So we at Amazon actually wrote a playbook and shared it on our website so that other community partners or others who are planning on doing pop-up clinics could use that. We've done a number of volunteer staffing efforts in Arizona and California and elsewhere. We have a COVID vaccination and testing blog that has more information, but it's been really amazing. I've had the pleasure of working very closely with our COVID community support team and to see how Amazonians are just eager to help in any way and how they get creative. They come up with innovative services like distributing test kits to teachers in Colorado, or staffing a call center in Washington to field 100,000 calls, for folks who are not connected to the internet. And Dr. Puckrin said something this morning about using data for community benefit. Well, you can now use Alexa to find your closest vaccination site. So a whole team of people in our devices division, had to take time to come up with that skill and to build it out and make sure that it works based on data sources. So the spirit of service has been really, really strong in Amazon and very evident in these times.
That's fantastic. And I'm so glad to know that you guys are so involved in many of the local communities to which I've belonged or worked. And is there anything, I guess, that you all have learned during this time, whether it be your employee vaccinations or the work that you're doing at outside places to try to help and increase the vaccination efforts, that you think would be helpful for government leaders and other employers to know?
So so first, for other employers, employee enthusiasm, for the workplace events, especially from folks who have been wanting to get vaccinated and haven't been able to find an appointment. Consistently we find that the first couple of days appointments fill up very quickly and people just appreciate the convenience. So that employee benefit really can't be overstated here. And another thing we learned is there is no clear and easy path for an interested employer to do workplace vaccinations at scale. Truly, the federal government and the states have not made this easy. We've had great partnerships with states and with localities, but that's required constant engagement. And most employers don't have a team of people working vaccinations full-time like we do. We're partnering and contracting with several healthcare partners nationally. And still there's no consistent way for them to get vaccines for workplace events. Some of them are able to use the federal pharmacy program. Others can only work through states. And the CDC guidance on employer vaccinations directs employers to contact their local health department and ask for assistance. Well, there are more than 5,000 local health departments in the US. And if you're a local health department, we might have some listening, you've just been battling a pandemic for 15 months. How much bandwidth do you have for fielding employer inquiries? That's just really tough. And if you're an employer with a large number of workers across the country, how do you coordinate with that many local health departments? So, I've heard from some fellow employers that they wanted to do on-site vaccinations, they built some infrastructure up, but then they gave up because there was just too much complexity and there was no certainty that they could actually get vaccines. So, they figured we'll provide an incentive, we'll do some outreach, we'll do some messaging, and that's where we'll stop. So I'm really hoping that as vaccines become more plentiful and governments can do more to help employers and more employers can get engaged in this.
Thank you for that. We focus quite a bit on our collaboration with members of Congress. And so, is there something that you would suggest that members of Congress, the Senate, et cetera, do to kind of help improve this situation?
Yeah, I definitely have some sort of federal and state government recommendations. None of these are things that would require congressional action, but could certainly benefit from congressional help. At the federal level, the federal government could dedicate a portion of the federal vaccine allocations specifically to employers in essential industries. So, for example, currently the federal pharmacy program participants, those pharmacies that can get federal allocations directly, they can use some of their allocations for employer-sponsored vaccination events. But they're not expected to do so. They're not required to do so. And in fact, when there's sort of a priority for the FPP, they may get pulled off of our events and say, oh, we can't provide clinicians to this right now because we have to go set up something over here. And so, a direct vaccine allocation sort of somehow focused on employers would really be helpful. And then beyond the FPP, the employers are just as likely to partner with occupational health providers, right? These are folks who already handle workplace flu vaccinations, maybe COVID-19 testing. There's already existing relationships. And those non-pharmacy providers, they're unable to participate in the FPP. So some sort of a federal allocation that they could tap into would also be very helpful and just expand the number of vaccinator entities that can serve employers. And then some employers have their own occupational health providers sort of in-house. So that's kind of another piece of the puzzle. So that's number one. Number two, I'd say, is a state level recommendation. State leaders can also do this. They can create statewide processes and guidance for employers and for their healthcare providers on how to get vaccine allocations from the state. Because again, even if you're an employer in one state or two states, but in multiple counties, having to coordinate with multiple local health authorities is a barrier, whereas having a statewide process is a lot easier. And then lastly, and going back to the federal government can direct states to prioritize employer-sponsored vaccination events. The federal government can signal that these events are a tool for closing vaccine access gaps, right? Just like we talked, and for reaching essential workers. On the essential worker piece too, there are a number of states, some large states, that went through age-based prioritization rather than, employment category. And so they went straight to eligibility for all and never provided a dedicated opportunity for maybe younger essential workers to access vaccination appointments. So prioritizing employer-sponsored vaccinations can help address that disparity, again, removing barriers, making it easier. And something else that we're seeing in a few states is the states are saying, okay, well, we want to help you. We'll give you dedicated slots at our mass vaccination site. That's great, but that's not sufficient because there's still that unnecessary barrier to the employee, right? It's time away from work, it's transportation, maybe it's childcare, and it limits that peer-to-peer information sharing in the workplace that I described, that buzz that's created when the event is right in your workplace. So I do hope that as vaccine supply expands and eligibility, being open to everybody, that the federal government and the states both work to really encourage on-site vaccinations for essential workers. Like I said, we don't need to pass a bill on this. There's no need for extensive rules changes. Just really a willingness to acknowledge that workplace vaccinations can be a great tool for reaching more people and for reaching them where they are.
Well, thank you for sharing that with us. And I think all of those points are very important to make. And sometimes it's good to have someone to connect the dots on all of these different fronts. And I guess as we kind of come to the close of our time together, do you have any other thoughts that you'd like to leave us with, or tips and tricks for those of us who are in the policy world out there?
Thanks. I don't know about tips and tricks. I'll just go back to my point at the start. If we're going to reach a significant number of Americans across all different communities, then vaccination should be an all of society effort. And so many speakers today have spoken to that, the collaborations that are needed. As an employer, Amazon has been working very hard to be part of that effort. We'd love to see more employers join us. We hope that the federal government, the states encourage them to do so, and that come July we can all be wearing "I got vaccinated" t-shirts. So thank you very much for having me. It's been an absolute pleasure.
Thank you so much for joining us. And for those of you who are still with us, I'd like to thank you again for joining the 19th Annual Summit on Health Disparities and sticking with us for the Congressional Awards and Fireside Chat that we just concluded. I know that there's another session that will start shortly, so this will be your moment to get some water and get ready for more engaging conversations this evening. Thank you so much for joining us, and we hope to see you all soon.